This segment of DelmarvaLife is sponsored by TidalHealth.
Diabetes touches so many here on Delmarva, and I bet you can think of at least one person who is living with the condition. Maybe it's you.
Well, let's break it down. Approximately 38.4 million people, or about 11.6% of the U.S. population, have diabetes. They're diagnosed or undiagnosed. Here on Delmarva, the rate of adult diagnosed diabetes runs above the national average, between 12 and 14.2%. Well, November is National Diabetes Month, and it's a time to shine a spotlight on this disease that touches so many. Kelly Birch is a certified diabetes care and education specialist with TidalHealth Nutrition and Diabetes Education. Welcome to DelmarvaLife.
Thank you. Thank you for having me.
So tell us, November is Diabetes Month, and it's right around the corner.
It is. November is National Diabetes Month. We have always had we call it a free diabetes awareness event, and it will be on November 10th. And it will start at 5:30, and we are actually at the MAC Center this year.
Okay.
So I wanted to really put that out because we've always had it at TidalHealth. So we have moved it to the MAC Center, and we will have speakers. We will have Dr. Vivar from TidalHealth Endocrinology, and we'll also have two of our new endocrinology fellows speaking with him, Dr. Singla and Dr. Tariq. So it's very exciting this year that we're having that. We've been having an awareness event for the past, I would say, at least 16 years since I've been there.
Yeah.
And they're very successful with many attendees, and we would love to have people that have diabetes or the family has diabetes. Like you said, most people know at least one person that has diabetes.
At least.
Yes, at least.
So obviously diabetes education, awareness is important, as you said. What would you want the community to know about diabetes, and even if they don't know somebody who has it?
Right, well, it would be good for everybody to know that so many people are at risk, right? If you're overweight, sedentary lifestyle, have a family member with diabetes, being over the age of 40, which I know doesn't affect any of us on stage right now. So there's a lot of people at risk. So knowing your risk factors is a big deal, right? And also, going for follow-up, seeing the doctor, seeing your, that's probably the best thing a person can do. Many times I will meet a patient in the hospital who hasn't seen a doctor in 15 years, and they are newly diagnosed with diabetes and some other processes going on because they hadn't been following up. So the most important thing I really believe is for people to follow up with a provider so they can get assessed and see if they are at risk for diabetes. But in the scheme of that, if you wanted to see if you were at risk, you could go on the American Diabetes Association website, and they do have a risk assessment test that anybody can do, and it is in a couple different languages.
Nice.
Are there ways for folks to be ahead of it and prevent diabetes?
Well, there are, again, weight loss, right? Exercise, 150 minutes of, exercise a week. Prevention comes, like I said, with a 5 to 7% weight loss. So it's not like you have to go out and lose 100 pounds. It's just, taking a few steps to lose a few, or that 5 to 7%, and again, that exercise. So the Diabetes Prevention Program did say that was the biggest thing to help prevent diabetes.
You'll be happy with yourself in the long run.
Exactly.
Yeah. Kelly Birch with TidalHealth, thank you so much for coming in.
Okay.
Thank you.
Thank you.